Oh, thank you so much, Sean, and thank you, Dr. Kaleem. We are very excited. The Prevention of Blindness Society has been in existence since 1935, and we focus on all kinds of healthy vision and on support for individuals who are facing vision challenges. And this is our very first time of kicking off a month long of Love Your Eyes campaign. So there are going to be a lot of health education opportunities this month. Most of them are available as webinars online, like today, but there are a few that are in person too, if you wanted to engage with us in person. So uh, please, I thank you for being here today because we're going to learn about a very important topic today, but there are a lot of important topics around vision. And in addition to our education opportunities, our board has also added a fundraising technique to this, very low key. If we have curated items from our thrift stores to be special gifts for people you care about. It could be friends, it could be significant others, it could be family members, just the people that we care about. And for the people that you care about, also feel free to spread the word about our vision education activities this month. And so to see the full list of activities that are open to everyone, you can go to Love Your Eyes DMV. So, the district, Maryland, Virginia, since we cover all those areas, loveyoureyesdmv.org. And I'm going to go ahead and turn this over to Sean, but I'm really excited about today's kickoff.
All right. Thank you so much, Karen. And I did put the website in the chat box, loveyoureyesdmv.org. Now, we're very excited with our guest speaker today. So today's topic is the aging eye, but most importantly, detecting eye health emergencies. As we age, a lot of different things happen to our eyes. Some of them are normal, some of them are not so normal. And some of these things are also serious things that we should really take a look at. And today we have a special guest here, Dr. Mona Kaleem, who's going to be talking about this topic. Dr. Kaleem is an associate professor of ophthalmology at the Wilmer Eye Institute up at Johns Hopkins University. She's fellowship trained in glaucoma and cataract, and she's broadly trained in the medical and surgical care of glaucoma. Her excellence in patient care, teaching, and research activities resulted in her selection to the American Glaucoma Society. She was also selected by her peers as a Baltimore Magazine top doctor in 2018, 2019, and 2021. And in 2020, Dr. Kaleem was honored with the American Academy of Ophthalmology's Achievement Award. Dr. Kaleem was born and raised in Maryland. Her background is in both economics and biology and chemistry from Smith College. She went to Howard University for her medical degree and also used Howard University as part of her medical training, along with the Mercy Medical Center and the Cleveland Clinic. Dr. Kaleem has a strong interest in volunteering and has participated in various medical missions globally and in underserved areas within the United States. She's also leads a podcast with one of her peers, Dr. Quigley, over at Johns Hopkins called Diagnosis Glaucoma Podcast. And she's also a member of our glaucoma task force at the Prevention of Blindness Society. So we're very, very excited to have such an impressive individual, both working with us and today to speak. So Dr. Kaleem, the floor is yours.
Thank you, Sean, and thanks, Karen, for the invitation to speak here. I'm really honored to have the opportunity to be the kickoff speaker for this amazing month for this campaign. And just to speak to this group, I'm excited not only to share information from you all, but to learn from you, because every time I speak to a group, I feel like I'm learning too, and it helps me to become a better doctor and a better educator. Today, I wanted to talk to you about eye health emergencies. And the reason why I think this topic is very important is because I believe in being your own advocate. I believe that we should all have knowledge to know what's going on with us, and healthcare providers are here to assist, to provide care, but we should also know what's going on with us and not feel so helpless. We should have some baseline education. So I wanted to review this important topic because there's lots of things that we're not quite sure. Is it an emergency? Do I need to go in? Is this something that I can treat myself at home? When I call the doctor's office, what should I tell them I think is going on, etc. So first, I just wanted to start off just kind of describing just the anatomy of the eye so that we all kind of know what we're talking about. And then to describe some things that are like routine, non-emergent situations that can happen with our eye and things that are more of an emergency. Just like a few basics about what the eye looks like. I use different terms to describe different parts of the anatomy. The cornea is what I refer to as the window of the eye. It's this translucent material that helps us, light is refracted against the cornea, and we can see through the cornea to the iris, which is the colored part of your eye, and that's what's labeled here. This patient in particular has a blue iris, and behind the iris is the lens. So this is what develops into a cataract one day. When we go even deeper into the eye beyond the lens, we get into a space called the vitreous cavity. And the vitreous cavity is hugged by the retina, and the retina is the most inner layer of the eye. One of the other outer layers of the eye, which I didn't describe just now, is the white part. There's a gelatinous part, which is called the conjunctiva, and then there's a layer underneath of that gelatinous material called the sclera. So when we talk about the white part of the eye, we're talking about the conjunctiva and the sclera. When we talk about the window of the eye, it's the cornea. And as I just said, the iris, the lens, and then the inner parts of the eye are the retina and also the optic nerve. And I refer to the optic nerve as the cable that goes from our brain to our eye and allows us to see. When we look inside someone's eye, this is what we see. We see something called a cup or a disc and another thing called a fovea. And this is the retina. This circle here is the optic nerve. So if someone was to develop glaucoma or an optic nerve condition, we would see the impact occur right here. For someone who develops macular degeneration, or maybe some of you have been diagnosed with a different condition of the macula, like a hole of the macula or a membrane over the macula, it affects this area called the fovea, and this is the area of fine central vision. So these two structures sit next to each other. And then these branches are the blood vessels that supply the optic nerve. Whenever we talk about the vision of the eye, so this is me being nitpicky, but vision is actually not just our ability to see letters and shapes and numbers. We traditionally think of that when we go to the doctor's office, we're checking vision, we're actually checking visual acuity. Our vision also consists of our contrast sensitivity and our peripheral vision. And so our acuity, our contrast, and our periphery are all important to our overall vision. But if you were to think about, if you notice that the vision was down in one of your eyes, you might want to take a second and think, well, what about my vision has gone bad? Is it the center of my vision, or is it the periphery of my vision? And is it at distance and near? And these are all questions as we as eye doctors will ask when we see you in an emergency room or in the office. We'll ask, well, where is your vision being impacted? Do you do okay when you look up close? Are you having your problems at distance? And I'll tell you, I do consultations in the hospitals. And as funny as it may sound, I have a lot of consultations for people who have vision loss. And when I go to see them at the bedside, I just have them put their reading glasses on, and all of a sudden they're able to see all right. So it's important to think about what type of vision is being affected, because there are diseases that can impact just the distance and ones that can affect just the near. Also, what about the eye muscles? Are they moving correctly? Do you notice that one of your eyes is moving out? Do your pupils look about the same size? So the pupil is the dark center. I call that the aperture of the eye. It's the structure that allows the light to go in. When we're in a dark room, the aperture increases, so the pupil gets big. When we're in a well-lit room, the pupil gets small. If your pupils are not getting big and small appropriately, then there could be a problem. And that could actually be an indicator of like a brain injury potentially. So those are important. Eye pressure is a risk factor for developing glaucoma, but eye pressure can be too high or too low. And you would not necessarily know when your eye pressure was too high or too low unless it was at an extreme. And also, what is the discomfort level you're having of your eye? It's very scary to say this, but many problems with the eyes are painless. And that really underscores the importance of going to see your eye doctor at least once a year, even if you have no particular conditions that are being followed. When we check vision in the clinic, or if you wanted to do it yourself at home, a really quick and easy way to do it, because we don't often have charts with us like they do in the doctor's office, is there are actually websites, or you can download an app on your phone called a visual acuity chart that will help you to check your own vision, and it will give you instructions. For example, cover one eye at a time, stand a certain number of feet away from this chart. And, you know, if we don't have a chart, that's okay. A lot of times, again, I see patients at the bedside, I'm in the hospital, and I don't have a chart. So I will do things like have them count the number of fingers that they're seeing, or ask them if they can see my hand moving. If they're not able to see my hand move, I'll actually just take a light and see if they're able to perceive the light or not perceive the light. And I check the distance, I check both distance and near vision depending on the situation. I always tell people, wear your glasses. So if you feel like your vision is down, put on your glasses, see, does that make an impact? I had briefly described the pupil, and the size should be about the same in both eyes. This test is not something that you're expected to do at home. This is something that we as eye doctors do. But I just wanted to get the point across that if you notice that your pupils are of a different size, like in this picture over here, you can see one pupil is very big and the other one is smaller, then there's probably a problem here. So you'd want to get an eye exam. And this type of a condition may not hurt at all. As I mentioned, lots of things that are eye emergencies don't really even hurt. What about the eye pressure? You know, in the clinics, we have these little devices that are used to check eye pressure. The eye pressure is not the same as blood pressure. So if your blood pressure is very high, it doesn't mean anything about your eye pressure. And a problem can occur when this pressure is too high or too low. I don't want you to focus so much on numbers, because the number of the eye pressure is, you know, there's a general range, but it can vary a little bit per person. What's good for one person may not be exactly good for another person. If you've had some kind of a trauma to your eye, like you were in a car accident, maybe, you know, I've had some patients who had an injury because they were doing construction work. So if you think there's some kind of a perforation or a cut or some big trauma, I would not recommend getting your eye pressure checked. But what I do, in cases where I don't have one of these machines, which is something that any of you can do at home, and I just advise that you do this very carefully. There's a technique called bobbiting. It's where we actually take our finger and I just kind of touch on the outside with my eye closed. I just kind of touch on the outside, and I feel both of my eyes, and I feel, are they about the same pressure? This is a light touch. This is not anything aggressive. But if you're ever concerned that maybe your eye pressure is extremely high, then that is something you can do. And I can demonstrate that over the video once I'm done with these slides. Another thing that we want to check is, some people tell us that they have double vision. If you have double vision, we want to know if there's a problem with one of the eye muscles. Double vision can be for lots of reasons. It could be because you don't have the right prescription in your glasses. It could be because you have a weakness of one of the muscles. It could be related to a trauma. Sometimes in traumas, muscles actually get stuck within the bones around our eye. It could be because, if, like, for example, in children, we see that one eye can go out or in. That's a condition called strabismus, and we try to correct it with surgery or with glasses. But there are lots of reasons why the eye muscles might move out and why a person may develop double vision. I do consider double vision to be an urgent situation. So if you develop an issue with that, I would recommend that you be seen as soon as possible, definitely within a week. And how do things on the outside of your eye look? Does your eyelid look puffy or swollen? Is there a bruise or a cut? Is it red? Does your eye seem to be bulging out on one side more than another? If it's bulging out, it could be a sign of thyroid disease, or there's lots of different conditions that can cause a bulging of one eye or both eyes, and we do want to evaluate that. That's something that is not like an emergency, but something that should be seen soon. If there's swelling around your eye or on your face, we do want to take a look, because there could be an infection. And if you go see someone for an eye exam, we'll do a complete eye exam. We'll look at all of these things. We'll also do a dilated exam, which is not something you could do at home. But again, this just gives you an idea of what the inside of our eyes look like. And so I wanted to now move on to red eyes, which is probably the most common reason why we get phone calls, and something that you yourself can probably triage and maybe potentially treat at home, and don't have to go into the emergency room to be seen the same day. But I'll also describe situations where you should maybe go to the emergency room or see an eye doctor within a few days. And these are some different pictures of how a red eye can look, and I'll describe all of these conditions in a moment. Whenever we as healthcare providers are talking to patients about emergencies or like a red eye, we always want to know, is it one eye or both eyes? Because if it's in one eye, then it could be an infection. If it's in both eyes, it's usually some type of an allergy, or it could be another condition. You know, are there any changes to the vision? Is there pain? Is there itching? Probably the most common way that we think about pain in our eyes is foreign body sensation, as if a hair was in our eye. Are we feeling light sensitive? Is there discharge coming from the eye? Is there a headache or a brow ache? If there's a headache or a brow ache, it could be a sign that your eye pressure is too high. If there's discharge, it could be an infection. If your eye is feeling light sensitive, it could be from something as benign as a cataract or something as severe as an infection of your eye. If you're feeling the foreign body sensation, it could be a scratch on your cornea, or it could simply just be dry eye. And I'll show pictures that will describe both of those conditions. If it's itching, it's probably just an allergy and maybe an infection. Pain can be for many different reasons, and a change in vision is obviously a more concerning issue. I always want to know, how long has this been going on for? Was there any trauma? And have you been around anyone who's been sick, or are you on any new medications? Contact lens wear is one of the most frequent reasons why people get a red eye or get eye pain. And the reason why is a contact lens sits on your eye. A lot of people sleep in their contact lenses or don't use them correctly, meaning they don't take them out when they should, or maybe they use them for too long. Wearing your contact lens for too long can cause an infection. It can definitely cause dry eye, which would cause irritation and discomfort of the eye. And it can also, as I mentioned, it can lead to an infection as well, especially people who have very poor hygiene. We see this a lot with college students during exam times. We always want to think, has someone had a surgery or a laser procedure or some kind of a procedure to their eye? And think about what are some of the known conditions that we might have, and is something being set off. So I just kind of want to go from the front to the back of the eye, some more common eye health issues that you may experience and have been wondering, well, what is that? It's very common for a person to have this condition called blepharitis. So the eyelashes, just like the hairs on our head, are prone to getting dandruff and also mucus or plugging. This is a very common reason why people get crusting of their eye or a white discharge when they wake up. A lot of people say that they have itching, and the reason why is there are these little kind of like a crusty solution or a crusty material that appears at the base of the eyelash margins. And I'm sorry if any of these pictures are a bit gross, but I just wanted to be able to show pictures of what we're actually seeing under the microscope, because some of you might actually be curious, well, what does it look like? This is a picture of how those dandruff pieces can land on the eyelashes, and they can be very irritating, just like we would have scratching on our head. We have itching of the eyelashes. There are also these little glands that sit underneath the eyelashes. They're called meibomian glands, and they can get plugged up with like a mucus, oily secretion that we normally would secrete from our body. And this is usually related to hygiene. So if you're not cleaning the makeup off of your eyelids, or if you don't wash your face enough, or just some reason why maybe your eyelids are just not that healthy, you are predisposed to getting meibomian gland dysfunction. And again, these are all reasons why you could get that crusting in the morning and discharge. Some people get tearing and irritation, and these conditions can lead to a sty. And I'll show you a picture of what a sty looks like. It's actually right here. This person has developed a big bump on their eyelid. If you develop any of these conditions, so blepharitis, meibomian gland dysfunction, or the sty, what I would recommend is just to try using a warm washcloth for about 10 minutes twice a day for at least a week. And if you can continue to do it preventatively thereafter in the weeks to come, that is a big help. What the warm compress does is it helps to remove these little plugs or dander pieces that land in our eyelid. I often tell people to look into a gel bead mask. Some people use them for comfort of the eyes, but actually they form a very nice warm compress and they hold the heat better than a warm washcloth if you can get that. Or some people take a clean sock, fill it with rice, tie it up, put that in the microwave, and that forms a compress. Again, that's going to help reduce any swelling that can occur of your eyelid from one of these dyes. Another thing you can do is what we call eyelid scrubs. So you can just buy these little pre-moistened towelettes at any pharmacy. It's something that just kind of cleans along the base of the eyelash margins, or just a quick way to do it at home is to take a cup of water, 1 drop of baby shampoo, and either a cotton ball or a Q-tip, and just clean along your eyelash margins as if you were putting makeup on your eyelids. And that will help to prevent and remove these little pieces of discharge, and then prevent that itching, the crusting, and the discharge that you're experiencing. And these things don't necessarily have to be seen by an eye doctor. They're very, very common, just as common as dandruff is on our heads. So you could just treat this yourself at home. With the sty, if you develop one of these big bumps as a result of these conditions, the warm compress is the #1 mainstay of treatment for situations where the bump does not decompress on its own after about 2 weeks. I would recommend seeing an eye doctor. We can prescribe an antibiotic ointment or do a procedure to remove these. These are actually not infections most of the time. It's just an inflammatory nodule. So just because you have a big bump on your eyelid doesn't mean that it's an infection. It is an infection most likely if it's very red and it's tender to touch. But if it doesn't, which is most of the cases, then it's just inflammation of the eyelid. And these are just blown up pictures to really show some of that. And I forgot that I had the slide, but this just kind of reviews the treatment methods again. This is a picture of the eyelid scrub, and I'm not promoting any particular brand. This is just a popular one. These are the things you can use to clean along your eyelashes, and I described using baby shampoo. Artificial tears are also very good in just preventing dryness of the eyes and for our general health. We don't describe ways we can prevent conditions enough. I think that we take our bodies for granted. We're using artificial tears every day, at least once a day for everyone, I think is a great idea. I personally use artificial tears twice a day, once in the morning, once at night, because the work that I do, I probably don't blink enough. I'm trying to read a lot and straining, and having the artificial tears on board, it's just like giving more moisture to your eyes and just kind of helping you get through the day. Ointments like this are reserved for situations where maybe a person has a sty on their eye, or has extreme dry eye, or has developed an infection, but ointments are not always used for infections. Now let's talk about that white part of the eye, the conjunctiva and the sclera. This is the most common reason why, or what we refer to as the pink eye. And there's different ways that a pink eye can manifest itself for different causes. It can be from a virus, it can be from a bacteria, it can be from some kind of chemical exposure or environmental exposure or an allergy. And how do we differentiate which of them is it? And is it an emergency that I need to go to the eye doctor right away, or what should I do? If you think you have a viral infection, like if you have a cough and a cold or a fever, and you develop pink eye, most likely you have developed a viral pink eye. And symptoms are things like itching, watery discharge. You may even have enlarged lymph nodes. These resolve on their own, just like a common cough or cold will resolve on its own. And we can't necessarily take the infection away, but we try to treat the symptoms just like we do with a cough or a cold. I recommend using artificial tears 4 times a day just to keep the eyes clean. And just keeping your hands clean, washing them, changing your towels, your pillow covers, trying to avoid touching the other eye, which is usually this starts out in one eye and then it can travel to the other eye, or why someone else may develop this condition. And this does not need to be seen by an eye doctor. This is something that you can just take care of at home, unless it's going on for a long time, not getting better. Now, there isn't a situation where a virus causes an infection of the eyeball and of the eyelid, and it should be seen by an eye doctor. This is shingles. And whether you've had chickenpox as a kid or not, or whether you have or haven't had shingles before, or whatever your situation may be, as we get older, many of us are predisposed to getting shingles. And one of the ways that it manifests itself is on the face. Commonly, what we see is this type of a rash where it just affects one side of the face and this particular distribution around the eye. This can really hurt a lot. And if this happens to you, then don't just medicate at home. Please make an appointment to see an eye doctor or even go to an emergency room. This should be seen, the same day or within a day, really. And if this happens to you, then you would need an antiviral medication just prescribed by a doctor. It can be prescribed by an eye doctor or by an emergency room doctor or even primary care. And for the discomfort around on the face, antibiotic creams are good. And they can be either picked up over the counter, but most likely you would just want to see a doctor and we can prescribe something for you. Next, I'll move on to pink eye caused by a bacteria. These are more serious. And the way to differentiate it from a virus is that with the bacterial infection, there's really thick mucus discharge. We do like to see this in the office or in the emergency room so that we can take a culture and send it to a microbiology lab to see exactly what the bacteria is. And we do treat with antibiotic drops, but for a viral infection, we don't treat with antibiotic eye drops. These are some pictures of a bacterial infection. And sorry, this one on the bottom is a bit gross, but this is like a real thing that we see. Most commonly, it's going to look like what you see up here, like this really kind of yellowy discharge. It can even be green. This is a more typical case. What you see down here is very uncommon. This is someone who had an infection from a bacteria called gonorrhea. We do still see these in the DC area. See them adults and in children, but there's like a lot of discharge and it just looks pretty gross, right? So that should be seen in an emergency room. Chemicals can also cause pink eye. It generally will cause pain, irritation, make the eye sensitive to light. This most commonly I see with like a chemical injury, like someone got splashed with like laundry detergent or some kind of a cleaning solution. Interestingly, acids are not as bad for the eye as a base. And most cleaning solutions and detergents are made of like a base. So if this happens to you, then please start irrigating your eye right away. And again, I want to bring up the point about using artificial tears. So artificial tears are like re-wetting eye drops. You can use that to irrigate your eyes. So if you just have that around, just like we all kind of keep a bottle of, Advil or, some medications at home, I would really recommend keeping artificial tears at home just in case something happens like this. But in the absence of that, just using water is okay just to try to clean the eye. But if you have some kind of an injury or exposure to a base substance to your eye, I would definitely recommend going to the emergency room. We have something called an irrigating contact lens. It's just exactly what it sounds like. It's a contact lens, and there's a wire hook up to it. And so we can actually irrigate balanced salt solution directly to the eye using that contact lens. Allergies are very common in this part of the country. Itching is the predominant symptom that a person may have, but watering of the eyes, and it's a watery discharge, unlike the bacteria infection, which there was like that yellow or green pus, and a virus, again, it's just going to be like a watery discharge. Usually with allergies, it affects both eyes. So if both of your eyes are pink or red, it's very high chance it's an allergy. Try doing cool compresses to your eyes, use artificial tears, and you can also pick up these over-the-counter anti-allergy drops. You don't have to be seen by an eye doctor if this is happening for you. And in fact, if you're having itching and discomfort and you've made an appointment, but it's not for a few days, might as well try one of these drops like the tears or the anti-allergy drops to see if that helps to improve your symptoms while you're waiting to be seen. These are some examples of situations where someone has an allergy to the eye and the way an eye can look. So if you were to pull your eyelid down and take a look at it in the mirror, you might see something like this. What about a blood-tinged appearance to the eye? Blood can occur for many different reasons. It can be in the setting of a trauma. So if you've had a fall, and even if you haven't had a fall, if you're on a blood thinning medication, you can spontaneously get like a blood accumulation in your eye. It's not that common, but it can occur. I get lots of patients who come to see me emergently for this picture here on the bottom. It's called a subconjunctival hemorrhage. Again, the conjunctiva is that clear gelatinous material, whitish material around the eye. And sometimes a little hemorrhage can form because one of the blood vessels bursts in the conjunctiva, and it looks very ugly. It does not hurt, it just looks bad. And these are benign. Can happen to anyone. It can happen if you're straining, if you maybe were coughing too hard, lifting something very heavy. It can happen if you were itching your eye too much. And the best way to treat this is really just to manage the symptoms, because the blood will disappear in a few days, just like a bruise on our leg or our arm will disappear in a few days. The best you can do is maybe just use artificial tears if you're having pain, and of course, just be patient. But these hemorrhages on the eye, they tend to look very bad. If we have a bruise on our skin, it doesn't look as bad because our skin is of a darker color, but here with the eye, the skin is white. So it looks very dramatic. There is a type of a condition called scleritis or episcleritis. This is most common in an individual who has an autoimmune condition. So this is not something you've done to yourself, like a trauma or an infection. This could be related to sarcoidosis, or if you have an autoimmune condition called rheumatoid arthritis, or there's lots of different autoimmune conditions. And one of the ways that they can manifest in the eyes is by causing this extreme redness or dilation of the blood vessels on that white part of the eye. And this should be seen in an eye clinic within a few days. If you're starting to see blue tinge to what should be white in your eye, that's a very bad sign. That should be seen the same day by an eye doctor. That could be a sign, and this is not very common, but it could be a sign that the white part of your eye is so inflamed that it's thinning, and that the inner contents of your eye, like where your retina are starting to be seen. That's an emergency, but very, very, very uncommon. And it would not happen on its own. It's only related to these autoimmune conditions in the more serious stages. And let's talk about the cornea of the eye. So again, the window of the eye. There's different ways that we take a look at it in the clinic. This is not something that you would be able to assess yourself at home. These are different pictures of how in the office, we put a dye in the eye with an anesthetic eye drop. And normally the cornea is going to be nice and clear. You wouldn't see any of these green patches. If there's a green patch, it means that there's a defect in the cornea somewhere. So this is someone who has an ulcer. This is someone who has an abrasion to the eye, to the cornea. And ulcers of the eye, they're often associated with redness and a lot of pain. An abrasion of the eye is going to hurt a lot also. It's very uncommon, and I don't mean to scare you, but if you have an ulcer of your cornea, you really should be seen the same day. Also, if you have a corneal abrasion, you should be seen the same day in an emergency room or in an eye doctor's office, because it's very uncommon, but sometimes the cornea is actually thinner or more scarred than you may think. And we don't want anything bad to happen. If you're a contact lens wearer, please stop using a contact lens. And we do treat individuals with these situations with antibiotics, eye drops. These are more extreme situations of someone who developed an infection of the eye. If you look at your eye in the mirror and you see white like this accumulating in the eye, then please come and see us right away. This is going to hurt. And this is also going to hurt, even though it's not an infection. This is just dry eye. Dry eye is extremely common. Dry eye can happen for so many different reasons. It can happen because of your contact lenses. It can happen because of a medication you're taking by mouth for anything, high blood pressure, diabetes. It could be because the heat is up too high in your house, or the air conditioning is up too high. It could be because you've been straining your eyes too much to read. So I do recommend that if you're having discomfort of your eye, like I described before in body sensation, Try using artificial tears to see if that clears your symptoms up. If it does, then probably it was just dryness of the eyes. These are pictures of someone with a corneal abrasion. Again, these are not things that you would see. It's something that we as the doctors see when we put that dye in the eye. And we typically treat with an ointment or an antibiotic eye drop. If you think that there's been a trauma of your eye or someone that you're around, please encourage them to come and be seen by the eye doctor right away. We need to figure out if there's been any preparation to the eye or around the eye and to do a complete eye exam.
Dr. Kaleem.
Oh, yes.
Hi, did your headphones by any chance unplug?
Can you hear me now?
It's a little quiet. The volume just kind of flipped all of a sudden where the headphone, I don't know if the volume's different.
I didn't do anything differently. Can you hear me should I speak up more?
If you can speak up just a little bit louder, we can still hear you. It's just a little quieter.
Okay, sorry about that. I'll speak up.
It just came back. I don't know what happened, but it came back.
Okay, I literally did nothing. I guess there's a ghost here. So another condition I wanted to talk about is uveitis. This is also something that can occur if you have an autoimmune condition. And I mentioned earlier sarcoidosis and arthritis as two autoimmune conditions, but there's many others. Someone who has uveitis has inflammation of different structures of the eye. We call them the uvea, but they can cause light sensitivity, redness, pain, a lot of tearing, a decrease in the vision. And this should be seen by an eye doctor the same day, or at most within like a day or two. And when someone has uveitis, we need to figure out why. It's usually an autoimmune condition, but it could also be an infection. So we want to rule out things like syphilis, tuberculosis. And if it just happens once, that's usually not a problem. But if it happens more than once, or it's a recurring thing, then it can indicate the sign of one of these underlying conditions we have in our body that should be worked up. Infections of the eye are like the more serious infections of the eye that affect the inner contents are really only going to happen if you have a history of an eye infection, or if you had some kind of a penetrating injury to your eye. Maybe, like again, I showed pictures of someone who was working with metal and they had developed like a perforation of the cornea. But if you have redness of your eye, okay, so if you've had an eye surgery and you have redness of the eye and the vision's going down, this commonly occurs like 2 or 3 days after surgery, then that's a pretty serious infection and needs to be seen right away. Please don't just stay at home and think it's going to get better. Please be seen. Not very commonly, but for people who are admitted to the hospital for a long period of time, especially in the ICU, they can develop like a fungal infection of their body, and that fungal infection can travel to the eye, and that needs to be treated with, we have antibiotics that we actually inject to the eye. But again, these are not very common. Glaucoma is another reason why a person might get a red eye or a painful eye. Classically, if you get a headache, especially right above your eyebrow, or there's a decrease in your vision, or you notice halos, then, and maybe you're feeling nauseated or experiencing vomiting, then please come and see us, the same day, especially if you have a red eye, or you notice that your pupil looks different. This is often a sign that the eye pressure is too high. There are also 3 general causes of vision loss. So earlier I just kind of described reasons for red eye, or some different ways that I described also some very common things that can occur with the eye, like blepharitis, and then I kind of went into more serious things. So I do want to describe some common causes of vision loss, and those conditions I just described don't always cause vision loss. But the reason why this could occur is if there's an obstruction of light to the back of your eye, if there's a problem with your retina, or if there's a problem with your optic nerve. And again, just think about the anatomy of the eye. Light goes from the front to the back. Anything that causes a problem in one of the layers can impact your vision. So if you have a problem with your cornea, your vision could go down. If you have developed a cataract, that can impact your vision. And if there's something in the back of the eye also going on. So things in the back of the eye, you wouldn't be able to assess that really well yourself. So I do recommend that you be seen by an eye doctor. We'll talk about different conditions, how serious they are. We have arteries and veins in our eyes. And if you think about a stroke is when one of the blood vessels to the brain, it just briefly goes out. The same thing can happen to the eye, independent of a brain stroke. This is like basically what I refer to as like an eye stroke. And what can happen is that there's sudden painless loss of vision. This can happen to someone who is predisposed to a cardiac condition or predisposed to a stroke, but not always. It can also just occur spontaneously, but usually there are risk factors. Again, there's vision loss. I commonly see it, like people will say, I just woke up in the morning and I just couldn't see anything. It was dark or it was dull, and it hasn't come back. And I don't have any eye pain. And this is probably a stroke of the eye. It could be from a blood clot. It could be from a vascular condition. And if this condition is not seen within 90 minutes, then the chances of recovering any vision are very slim. So I would be seen as soon as possible if you experience a sudden painless loss of vision. That's not normal. And it can be a sign of a stroke, which is even more serious. These are pictures this is what we see as eye doctors. This is someone who has developed some swelling in the back of their eye and what we call pallor. Pallor is when the blood is just not flowing correctly to the eye. And this is a situation where there's hemorrhages all over the eye. And this is from one of these conditions. The way that this is treated is with, the way it's treated is obviously to get an eye exam right away. In some situations, we need to lower the eye pressure, even though it's not caused by glaucoma or caused by a high eye pressure. Again, it just has to do with the physiology of the eye. So lowering the eye pressure is important. Some patients also need something called a hyperbaric chamber, where they breathe in supplemental oxygen. We do have a hyperbaric chamber in Baltimore at the University of Maryland. I am not sure in DC or Virginia where there is a hyperbaric chamber, but often we will send patients to the University of Maryland for this treatment. And some individuals need laser treatments to their eyes or injections to their eyes to treat these conditions as well. But the most important thing is to figure out why this happened and then to try to minimize the risk factors for developing a more serious condition, as I mentioned, like a stroke. Retinal detachments can also occur and cause a painless loss of vision. So again, I mentioned the retina is the inner wallpaper of the eye. If something happens and it just starts to detach, people can see flashes and floaters, or there's like a curtain drop in the vision, or maybe black spots that don't go away. Some people notice a wavy distortion, and risk factors for this are some kind of a trauma. It could be a car accident, like an airbag deploy. It also can occur in diabetics. People have a very long eye. You wouldn't really know if you have a long eye, except one way to detect that is if you have a very thick prescription for glasses. Myopia is what we call it, having a long eye. People with very long eyes are predisposed to this. As we all get older, we're predisposed to this condition as well. And macular degeneration can be it is a chronic condition, but there are situations where there are emergencies of macular degeneration, and you should be seen really within a day or two, if possible. Macular degeneration is a condition where the structure I showed you earlier called the fovea develops breakages in the inner layers, deposits and debris, and it decreases the clarity of the vision because the macula is the area of your fine central vision. If this happens, then you may develop distorted vision, kind of like these pictures here. So it should actually be completely straight, but things are wavy. And this is another diagram of how a problem with your macula can appear. Again, waviness, like a dark patch, a blind spot, things look like elongated. There's all different ways to describe it. And if you're having an episode of acute macular degeneration, then this could occur, but it could also occur if there's a condition called an epiretinal membrane or a pucker or a hole of your macula. Same types of symptoms can occur, and I would recommend that you be seen, really like within a few days by a retina specialist if you can get in with a retina specialist. If not, you can just see any eye doctor, but you are going to be eventually referred to a retina doctor. And there's another condition called giant cell arteritis, which seems to be more common as we get older, and especially in women who have arthritis. The symptoms are things like a headache with jaw pain. I mean, jaw pain can also be from a dental issue, but if you have the headache and jaw pain and a history of arthritis, you're also experiencing fever, weight loss, and you're just not hungry, and you have some loss of the vision also, then this is generally, we always do a workup for giant cell arteritis, and this is a very serious condition. It should be seen the same day. We actually admit patients to the hospital for this and have to treat them with steroids and to do a biopsy, because what's happening is that this artery called the temporal artery is becoming inflamed, and you can see it runs in this direction, like in our neck and then above here to the temporal part of the skull. So just a few key points. When you feel something's wrong with your eye, think about your vision. Is it double? Is it doubling? What's going on with your vision? Do you have pain? Do you not have pain? Do things seem distorted to you? Are you seeing black spots? Are you seeing floaters, a curtain-like appearance? What's kind of going on? Just kind of like describe it to yourself. Think about it. Is it something simple like, oh, I'm just having itching and redness? And then think, is this something that I can just maybe treat myself at home, or is this something that I should go see the eye doctor for? Of course, we're always there to see everyone and to take care of all of these conditions and advise you correctly. But I think just like knowing what some of these conditions are can, again, empower you to have the knowledge when you call the doctor's office to make an appointment, or to know when you should go to the emergency room, or how to treat something yourself potentially. But don't wait around to get the care that you need. Please come and see us. I just wanted to show a picture of our team. I'm a glaucoma specialist and a cataract surgeon at Johns Hopkins. This is our group. There's 9 of us attending doctors, and we have fellows and residents that work with us. Please come and see us if you have glaucoma, cataract, if you have any other conditions. We have a full office staff. I work out of 2 offices in Bethesda and in Columbia. We have lots of specialists. We're more than happy to see you at either of these 2 offices. We have pretty much every specialty you could ask for. And I just want to again thank you all, and I'm looking forward to answering some questions and having a discussion. So thank you.
All right. Thank you so much, Dr. Kaleem. That was great. I know I learned a lot. So we're going to have some time now for Q&A. So for everyone, please feel free to unmute yourself and ask your question. The mute button is at the bottom left of your screen. Alternatively, you can also press the Alt button plus the letter A to unmute yourself. And if you're on the phone, it's *6.
There are some questions in the chat I can answer.
All right. And first we have Phil, who he just unmuted himself. Phil, did you have a question?
Yeah, I have a quick question. I'm being treated for blepharitis successfully by an ophthalmologist, but 6 months ago, he gave me some antibiotic cream because I guess I had a little bit of an infection. I used that and it cleared it up. Should I be using that cream periodically, or should I wait until I actually need it again?
For blepharitis, I would recommend just using the cream as needed. The most important thing for blepharitis is going to be the eyelid hygiene and artificial tears, and that should be done as a preventative thing, not just as needed.
Thank you.
All right, and we did have a question in the chat box for you, Dr. Kaleem. Let's see. Is keratoconjunctivitis sicca a chronic condition that cannot be cured? And what are other long-term drugs for treatment besides Optimune?
So keratoconjunctivitis sicca is the medical term for dry eye. And we tend to use this medical term when it's a more chronic condition, not just like a come and go. And keratoconjunctivitis sicca, or severe dry eye, is often from an autoimmune condition. Can it be cured? yes, it can be cured, but it does require a lot of treatments and preventative measures as well. There are different eye drops that can be used. Someone mentioned cyclosporin. There are also other eye drops that have been developed for dry eye. There's one called Exidra. There are a few others on the market also that are, an individual can use like once or twice a day chronically to try to prevent the dry eye. It works for some people, but not for everyone. And sometimes it's a matter of figuring out what works best for you. The most important thing is to use artificial tears, and I do recommend the preservative-free ones. They're the ones that come in a little vial with a twist-off top, not the one in the bottle. The artificial tears without the preservatives do provide the most relief, and often it's the preservative in eye drops that can, in fact, irritate us.
Thank you. One question we commonly get is makeup with the eyes and increasing chances of a lot of these different infections. There's folks out there that'll put their makeup on and then they won't clean it off for a couple days. Could you talk a little bit about that and what that would increase our chances for?
A stye. So it's very common to get blepharitis or a stye. I mean, I have a friend, she's a makeup artist. She does great makeup, but she gets probably a stye a few times a year. And I keep telling her, please just clean along your eyelashes. So they sell these eyelid scrubs at pretty much every pharmacy. You can also use the makeup removers. And even if you're not someone who uses makeup, you can still use those pads just to clean along the base of the eyelash margins. But styes, as I mentioned, are generally not an infection. It's just an inflammatory nodule, but they look ugly. They don't feel good. And I definitely would not use makeup for a few weeks after having a stye.
Thank you. Question in the chat box, Sustain, does that have artificial ingredients?
Most of those eye drops are they're made of different things, but balanced salt solution is like the top ingredient. And Sustain, if it's preservative free, is what I would recommend. The preservatives, they'll often be indicated on the bottle, but it does have artificial ingredients. Like these eye drops are not made of it's not like the serum from a human or an animal or anything like that. And then the polyethylene glycol and polypropylene glycol. Again, I would try to stay away from things with preservatives. Boric acid is a common preservative. They're also used in medications that we use for glaucoma, like glaucoma, antibiotic eye drops, steroid eye drops can have preservatives in them. If you have an allergy to a preservative, there are actually preservative-free alternative glaucoma medications and drops that can be formulated for you. There are pharmacies all around the country. There's one in Hunt Valley, which is in the Baltimore area, that can make eye drops without preservatives just for you.
All right, and we did have another question. And folks, if you want to ask a question, please feel free to unmute. I'm just going through the chat box right now. Somebody asked, their dog has diagnosed with type 1 diabetes. They're still running glucose curves and whatnot. In the interim, they have cataracts in both eyes. Is there potential for cataract surgery? Is it going to be the same as with humans?
There are ophthalmologists for animals. They can do cataract surgery.
One comment on the single-use artificial tears. I use them also, but I know some friends of mine have complained that they're a little pricey. I found that I found a small glass jar with a lid. I found that if I use the single-use ones and then put it in that clean jar with the lid on, I can get 2 or 3 uses out of them. So it saves you some money. I like those much better than the bottled ones with the preservatives.
Mm-hmm. You can also buy them at Costco, Sam's Club. I know that they sell Refresh. Refresh, actually, you can twist off the top and recap it.
Oh.
Sustain, you can't do that.
I haven't tried that, but that's interesting. I'll give that a shot.
Try it, yeah.
I have a question about the allergy drops for Does it affect glaucoma? Like, does it raise the pressure like the allergy tablets do? Some of the tablets, usually doctors say don't take them if you have glaucoma.
No, it should not increase the eye pressure. Medications that can increase the eye pressure are generally steroids and some headache medications. There's two types of glaucoma, open and closed angle, but generally the culprit is a steroid.
Thank you.
Great. Eileen, go ahead.
Me?
Look, Eileen, you had unmute yourself. Do you have a question?
Oh, yeah, I thought you were reading my mind because I did have one, but I
Oh.
how did you know that? The refresh that you're referring to, can you only buy it in Costco? And is it in vials also?
It's in vials. You can buy it at any pharmacy.
Oh, great. Thank you.
All right, we have time for one or two more questions, then we'll have to wrap up here.
Question, is Sustain a prescription?
No, it's just an over-the-counter. There's a lot of great things that can be picked up over the counter, but Sustain and Refresh, all of the artificial tears, you can just pick up on your own. And the anti-allergy drops, if you're having a lot of itching, again, which is so common here in the DMV area. There's no brand in particular that I recommend, but some of the more popular ones are like Pataday, Optivar, Nafcon, Zatador, etc.
Is there anything by prescription for dry eye?
Yes. Restasis and Exidra are two. There are one or two more things on the market, but I'm not too familiar with them. There are dry eye specialists. Generally, a dry eye specialist is also someone who's a cornea specialist, but some optometrists are also trained in dry eye. But it is actually a specialty that people undergo extra training just to treat that condition because it can be very chronic and very bothersome for people.
And that would tend to be an ophthalmologist.
Yes, generally a cornea specialist.
Who is, okay, specialty within. Okay, thank you.
Yeah, sure.
A quick follow-up on the over-the-counter. We also see near them ones that talk about getting the red out. Is that the same thing or is that different?
So all eye doctors do not like Visine. Please don't use Visine. The way that it works, it kind of gets you addicted because it how it gets the red out of your eyes is it constricts your blood vessels in your eye, and so your eyes seem like they're quiet and white, but then as soon as the medication wears off, the blood vessel goes back to like its dilated state and then it looks red again, so you become very dependent. So just be careful with those drops. I always recommend just artificial tears.
Is there any additional consideration of for someone who's had a stroke in terms of choosing a dry eye drop?
Ointments work best. Refresh gel ointment at night is very good. Lacrolube or Genteel ointments. I would recommend putting that in right before a person goes to sleep. There can be some decrease in the clarity of the vision right after a gel goes in the eye, but in the morning it should be much better.
And then final question, Dr. Kaleem, we had this a presentation a couple of days ago and someone had asked this to me, was they talked about their floaters, and then they also mentioned, well, we've heard about people getting a bunch of floaters all of a sudden. And my understanding is that could be an emergency, such as like a detached retina or something like that. Could you clarify on that or maybe share?
There is a phenomenon where in our vision, maybe we see like a little squiggle or a bug or a black spot, and it's moving around. It just kind of comes out of nowhere. There's different reasons why that may happen. The number one reason is called a posterior vitreous detachment. So in the cavity of the eye, the back of the eye, there's a jelly that maintains the shape. A little piece of that jelly can kind of just come off of the big body of jelly and form a little particle that moves around. And it just moves on its own, like we don't control it. So that's a very common condition. Now, it is dangerous if you see a shower of those floaters and they're not getting better, because that could be a sign of a retinal detachment, because sometimes that little particle that's moving around sticks to the retina and pulls the retina with it. So that's a reason for a retinal detachment. So if you notice floaters, then you should be seen by an eye doctor within a day if possible.
Right. All right, Dr. Kaleem, thank you so much for the presentation today. This was great, and I really appreciate you taking time. This was a great start to our campaign, and I know we learned a lot. This has been recorded, everyone, so we will share the recording likely early next week. But if you have any other questions in the future, please feel free. You can either reach out to me and I can forward it to Dr. Kaleem, or if Dr. Kaleem, if you have any contact information you want to share, please feel free.
Sure, I'll put my email address in the bottom here. And I'm also going to put the website for our podcast. Dr. Harry Quigley and we started a podcast a few years ago. It's called Diagnosis Glaucoma, and we started it for glaucoma patients and people who just want to know about glaucoma. And we decided to do audio because not everyone can see very well to read a book, and some people just are busy and on the go all the time. And we also wrote a book together. It's, again, about glaucoma, but it's both in a written version, which can be purchased or free online. And we also have an audio book, again, for the same reason that I mentioned, we started a podcast. We answer a lot of questions, even just about cataracts and other things too. It's not all focused on glaucoma. And if you ever have any questions or an idea for a topic, please send it to us. You can email me directly, or you can send us a message on our diagnosisglaucoma.com website. We love the podcast actually comes to us. The topics come from patient questions. We had a question box at the Wilmer Eye Institute downtown Baltimore, and we just simply took questions from that, and that's how we developed the episodes. And we're also doing a lot of great work at Johns Hopkins, various research studies. I would love to partner with some of you. If you're interested in learning more about the work we're doing, please reach out to me for anything. Thank you again.